refer to page 7 of your slides, and we're going to go into the stages of the pregnancy, starting with the first trimester. Now, the first trimester is considered weeks 0 to 12. This is probably the biggest trimester for changes happening physiologically and emotionally for the mother. It is the highest risk of miscarriage, so that when we need to highlight the symptoms that can occur. So what we've got is slides here, which this information is in your manual, but we thought we'd go through it and get you to jot them down as well. So just to reiterate that these symptoms are not, they don't happen in every pregnancy. Not every pregnant female is the same. As I mentioned earlier, that every pregnancy is different. So just jot these down. These are symptoms that can occur in the first trimester. The first one is fatigue. So this is the most crucial section, trimester, for the development of the baby. Chances are the mum will still be working as well. So not only do they have that extra energy expenditure happening for baby's development, they're working their 9 to 5, which they'll already be tired from. So just bear that in mind if you are going to train your clients in this section. Chances are they're going to be a bit tired, a bit more tired than usual. So with that in mind, what we recommend is that you encourage rest periods and make sure that your clients' energy levels, that they're trying to keep them up by eating little and often. Number 2, we'll get you to jot down is nausea or morning sickness. Now, the reason we don't call this morning sickness, we call it nausea, is because it can occur at any stage during the day. Quite often it does happen at the same stage of every day. So if they have nausea at 1 o'clock in the afternoon, chances are they'll have it at 1 o'clock or in that afternoon, around that period every day. So what we recommend with this one is that you reiterate to your clients that they keep their fluids up. And of course, if you are scheduling sessions, try not to schedule your sessions for 1 o'clock if they're being sick every day at 1 o'clock. Number 3 we'll get you to jot down is hypoglycemia. So obviously if your client is suffering from low blood sugar levels even before the pregnancy, what we'll get you to recommend to them is to take a high carb snack prior to training. Now, this doesn't have to be a high carb meal, a full meal, but just a snack so that their blood sugar levels don't spike too low during your session. Number 4 we'll get you to jot down is micturition. Now I'll spell that for you. That's MICTURITION. As I mentioned, that will be in your course manual, but just if you wanted to jot it down now. Now, micturition is to do with urinary frequency. Okay. So as progesterone levels increase, along with the increase of a hormone called HCG, this increase stimulates blood flow supply to the pelvic region, which can result in bladder irritation. So a lot of mums obviously run to the toilet quite often. So micturition and the increase in hormone levels is the reason for that. Number 5 is breast changes. So once again, with the increase of estrogen and progesterone, this can cause the breast to grow. Now with this one, with your clients, which you do say is just recommend a sports bra, as obviously a normal bra where you're exercising can cause discomfort. The symptom that mother can have during her first trimester is reflux and indigestion. Once again, due to the surge of hormones, there's a decreased space for abdominal contents. So because of that, obviously, what you want to try and stop your clients doing is staying in a horizontal position for long periods of time, and any bouncing exercises. So any sort of plyometrics, take those out, as that can cause or exacerbate reflux and indigestion. Now we want to move on to quite an important section of the course, talking about the role of relaxin during pregnancy. Relaxin is one of the more important hormones that you need to be aware of from an exercise perspective. So relaxin essentially is a hormone released into the mother's system, and it's designed to create, I suppose, elasticity and soften up the structures of the musculoskeletal system, particularly around the pelvis. So, essentially, if you can imagine this hormone, which relaxin, is being released into the system, it's designed to soften it up so that at childbirth, at labour time, it's easier for the mum's pelvis to expand and therefore give birth. Now, this hormone actually peaks at week 14 of pregnancy and again at labour time. So if you can imagine, it's increasing right the way from their first trimester. Now, with relaxin, one of the things you need to bear in mind is that it isn't just released into the pelvic region. As I said, it's released into their system, and it does affect all musculoskeletal systems. So one thing you need to bear in mind with this is that due to the elasticity that it creates in the joint structures, it's a highest risk of strains and sprains. So what we recommend is taking, for example, stretches back to 70% of their normal depth, or some exercises. Like if you've got someone that can squat quite deep, you probably take them back to about 70%. Just because their joint structures, they're not strong enough to take the load, and you don't want to overstretch them as they're already elastic enough. So on top of that, what we would recommend away from is high impact exercise and any sort of jerking motions. So plyometrics, for example, would probably be a no-go in this trimester. Other changes in the mother's system. Another hormone, as I said, hormones are quite important in this section. So hormones, one named catecholamines. Catecholamines are produced in the adrenal glands, and they are produced during times of emotional or physical stress. Now, catecholamines are designed to mediate blood flow distribution. So if you can imagine, if you're putting your pregnant client under tension for quite a long period of time, catecholamines are going to mediate that blood flow distribution to the muscle group that's working quite hard. So for example, if you're working their quadriceps quite hard, you're getting a lot of squats or a lot of leg press, then chances are the blood flow is going to go to the quadricep, which essentially means it's going to come away from the uterus, which is really where you want the blood flow distributed to. So if you do have a client and you're pushing them too hard, what we recommend is obviously plenty of rest periods, intermittent rest periods. So don't push them. Once again, we talked about the length of strenuous exercise. Don't push them past that 15-minute mark, and get the rest periods in there as much as you can. The next change in the mother's system in that first trimester is with the endocrine response. Now, once again, we refer back to relaxin. Relaxin is released into the system, designed for pelvic flexibility, but it is released into the veins, valves, and intestines. So therefore, food can become harder to digest, and mothers can suffer from heartburn and indigestion. Once again, this doesn't happen to every pregnant female, but it can happen. So what we would say, if this does happen, is to encourage a fibre-rich diet. The third one here is blood. Now, there's roughly 30% more blood in the mother's system during pregnancy. So obviously there's going to be an increase in blood pressure and an increasing resting heart rate of roughly 10 to 15 beats per minute. So again, that means the cardiac output can increase by up to 50%. So we don't use heart rate monitors anymore to judge the intensity of the exercise. The reason for that is different people's hearts react differently to different stimulus. So my heart rate may be different to yours if we went on a 5K run, for example. So it's not a representative test for the intensity, I suppose, of the exercise. As a general rule of thumb, what we say is if the mother can still hold a conversation with you, she's not working too hard. Now later on in the course we will talk about a scale of exertion for you, but just as a general rule of thumb, if they can have a conversation with you, they're not working too hard. Which leads me on to my next point, the respiratory system. Now there's an increased minute volume and a decrease in O2 uptake, which obviously puts stresses on the system. As the uterus expands, it puts more pressure on the diaphragm and the lungs. Obviously, if this does occur, what we recommend is that you decrease your aerobic work with your clients and interval training. So the sprint work should be out of the question. The next slide, wrists and carpal tunnel syndrome. Now, once again, as relaxin is released into the system, as we mentioned, there's a higher risk of strain to sprains. So what you want to avoid is any heavy loading, excessive loading on the wrists, i.e. push-ups, not too many push-ups if they are suffering from it. Just bring it back, maybe to push-ups on the knees, for example, and then just, I suppose, find a regression to that exercise. The next point here is feet. So the feet, once again, can increase in size. With the added relaxin in the system, what it can lead to is fallen arches. The extra load on the mother's system, the feet begin to expand and swell out like so. So just be wary of it. It can lead to pronation, supination. Essentially, it can lead to postural issues, aches and pains. So just be wary of it if they are suffering from any feet pain. Now the veins, we mentioned these briefly earlier, but relaxing, once again, it increases the elasticity in the veins, which can lead to valve incontinence. So what we would recommend, for example, is using muscle pumps. Calf raises, for example, if there is a valve incontinence and the blood flow isn't being distributed to every part of the body like it normally would pre-pregnancy. For example, the feet. Calf raises are a great example of muscle pumps that you can use. And finally, blood spotting. Now, blood spotting can occur in several ways. It could be a nosebleed, it could be bleeding gums. So, depending on the severity of it, depends on whether you do refer them out to a doctor or a healthcare professional. But don't be alarmed if they do start to have a little nosebleed. It can occur for quite a few females. So, in essence, how does that impact on your exercise regime? So, obviously, the fatigue and nausea can lead to your clients slowing down, not working to their normal pace and their normal maximum effort levels. So, just bear that in mind. If you are, a harsh PT that will sit there and scream at your clients, now is maybe not the time to do that. Be very aware of the role of relaxin. Now, I mentioned it so many times in this section because it is so important. What we'd say as well is if they have been doing a resistance program, for example, leading up to it, 6 months prior to getting pregnant, they can continue to train in that way throughout their first trimester. And what we've got here on your slides is just a few little slides on how the baby is developing during that first trimester. I won't go into it in too much detail, but if you did want to have a little read through for your information, it's all there for you.